Plano, and today we'll be discussing a little bit about butt implants. Butt implants are a great option. It gives people more volume, a better contour, and it's really good for patients that are thin. And that really there's not much liposuction to be performed for a good, effective fat transfer. And there's always the best option for rejuvenation of the buttock region is going to be a fat transfer procedure. But in patients that already had surgery and there's not much fat to remove, or someone that's very thin and very athletic, the other option is a buttock implants. The difference between the Brazilian butt lift, when you actually add fat, and the butt lift using implants, one is obviously using your own tissue, fats, and the other is using a silicone implants. These implants are different from breast implants. They're a little bit more firmer, they're not as squishy, they're more cohesive, and it's not filled with any gel like we have for silicone breast implants. They come in a few different sizes, and just with breast implants, the bigger the implant, the higher the complication risk. And so I like to use like medium size or smaller buttock implants. And I'm still using a little fat transfer because we like to lipo the back with any buttock implant. And we usually place the fat along their outer buttock region. And remember, the buttock implants go more centrally and medially along the entire buttock. But on the outside, there's no implants. And that's where for the contour, a little bit of autologous fats or fat transfer really goes a long way to really shape the entire bottom area. The buttock implant is placed between the gluteus maximus muscle. There are also descriptions where you can place them above and below, but there's a higher risk of complications and more visibility of the actual implant. So the best route to place these implants are between the muscle fibers. The recovery for buttock implants is a little bit more intense than fat transfers. You can't work out instead of 6 weeks for about 8 weeks, and you're sleeping on your stomach for maybe a good 6 to 8 weeks afterwards also. Most people return to work after 3 to 4 weeks if it's not a physical job. So for more information, this page is very informative. You'll see some before and afters. You'll have some frequently asked questions and what the procedure entails. If you have any questions, please feel free to contact your office.